Hey everyone, I'm Reed Alexander. Thank you for joining us here on Retreat Behavioral Health's website, YouTube platform, and social media pages. Great to have you here. Of course, as you know, at Retreat, we're committed to in-depth conversations around important mental health issues facing our communities. And during the course of the coronavirus pandemic, so many people, studies and research have shown, have been suffering significantly as they've tried to get the mental health consequences of 6 difficult months of lockdown, trauma, loss, and pain under control. But here is someone on the vanguard of confronting those stresses in our communities and providing helpful resources and value to people who are suffering right now. Today on Headspace, we've invited Sharon L'Herrou. She's the CEO of the 211 Helpline in Palm Beach and the Treasure Coast in South Florida, and a friend of Retreat's, to join us to talk a little bit about what kind of impacts of the virus she's seeing in the communities that she serves. So Sharon, great to see you. Thanks for making time for us.
Thanks so much for having me. It's great to see you again, Reed, and we always appreciate the partnership we have with Retreat.
Oh, absolutely. No, it's a pleasure to have you. I wish it was under different circumstances. I know
I
from
know, what a crazy time. It's been so difficult for everybody.
it's been challenging, and I know you and I have talked, and you've been witnessing the difficulties firsthand in our community. So I wonder, why don't we start in this conversation with a quick primer, sort of the background or context on what you've been seeing. We're 6 months into the pandemic. Unfortunately, there's no deadline for when this is all going to be behind us.
Right,
Hope it's soon, but really
right.
anybody's guess. What are you seeing in the communities you're serving? How do you think the coronavirus pandemic has impacted the mental health of people whom you interact with through 211?
Well, as you said, we are seeing it firsthand. So ordinarily we would expect on our helpline, we serve a particular geographic region in South Florida. So normally we would get around 200 requests for help every day, 200, a little bit more. In the early days of the pandemic, in the first few weeks, that volume almost doubled. We were getting close to 400 calls a day. So what we're seeing is that throughout this entire crisis, people are experiencing it differently and yet similarly, right? So what's happening is almost no one has been unaffected. The calls we're getting are about people who are feeling stress and anxiety, usually in one of two ways. Either they're very, very worried about the virus itself, how to stay safe, especially in the early days, where to get tested, what the protocols were. If you remember, they were changing. At first, we were told it should be, we should be spacing out 3 feet. At first, we thought masks weren't as important. Then as we learned more about the disease, it's no, we need to be at least 6 feet, and then we should be wearing masks. So as that information has changed, people have contacted us to get clarity on it because there's been some confusion. So one group is really just trying to figure out how to stay safe and how to cope with the virus itself. And another group is trying to do that as well as being worried about the economic impacts. People very quickly lost jobs. People have been laid off. We're getting calls from people who are worried about unemployment, paying their rent, paying utilities. So it's just a huge range of emotions that people are feeling, but a lot of anxiety and stress.
Yeah, so two kinds of stress, it sounds like you're generally categorizing this in. One is sort of the mystery of the virus. How do we keep ourselves safe? How much is it spreading? Are we safe? Are we not? Changing
Right,
population. And the other sounds like the knock-on effects that the virus and our response to it have produced in terms of so much economic pain and hardship for so
right.
many people. And what's really unfortunate is it seems like the march of the virus has continued largely uninterrupted in the last couple of months. So I imagine that you're hearing continued effects and just continued mounting stress as we head into the fourth quarter of the year. So why don't you tell me a little bit about general, data points? How many increase in calls have you seen? What percentage increase? How many calls are you getting now? Have things begun to stabilize?
Yeah.
How has this impacted the people that you've got answering the phones and providing feedback and help for people?
Yeah, like I said, in the early days, in the weeks, there were several weeks after the national emergency was declared that our call volume almost doubled. We had to make a lot of changes in the way we operated, obviously, trying to do as much as we could remotely, having a core group here on site and doing distancing and safety protocol procedures. So in those early weeks, it was very, very challenging. We actually pulled staff who had been cross-trained from other areas to help with that volume, because otherwise we wouldn't have been able to manage it without extensive wait times. So that's what we were facing initially. Over the months, as people seem to have kind of come to terms with, I hate to say the new normal, but at the moment, the new normal,
Right.
then our call volume has stabilized a little bit. So it's still higher than it was last year, but it's between 10 to 20% higher than it was last year at this time on any given day.
So you went from doubling to now there's been a reduction. Now you're about 10 to 20% higher. So
Exactly. So
I suppose that seems a little bit encouraging, unless there's a lot of people who aren't raising their hands for help. But it sounds like the acute shock of it all has begun to stabilize. Would you say
I,
that's a fair assessment?
I would say that's a fair assessment. That seems to be what we're seeing. Although, as I've said, almost every single caller is feeling a very high level of distress. And, you know, I can tell you about anecdotally a couple of the things that we've seen if you would like.
Please go for it. We'd be very interested
Sure.
to hear.
Yeah, just off the top of my head, some of the stories that our staff have shared with me that you know, I really hold in my heart. And obviously I can't share any identifying information, but one of them was a young adult with a young child who works in the medical industry. So they're a nurse, and they called in distress because they were saying that, it actually chokes me up just thinking about the situation. They said that they had not seen their child in weeks and weeks because they were self-quarantining because they were on the front lines, and so they were worried. They were so worried about taking that virus home and causing some kind of impact to their child or their loved one. So we've got situations like that from somebody that's basically a healthy, productive, you know, happy member of society, really on the front lines confronting this pandemic, and just needed to reach out and talk to somebody about it, somebody that wouldn't be judgmental and that could help them think through and empathize with the situation that they're in. And we got another call just actually last week. One of the supervisors mentioned to me from somebody who was not able to pay their bills. So they were worried about paying their rent. They were worried about paying their light bill. They had been laid off. Other members of the family had been impacted. So they had been holding it together for a while, but this month it really hit the fan. And one of the comments that they made is that if they had to prioritize, they were going to prioritize their rent, because at least if the family was sitting at home in the dark, they would be safe in a shelter as opposed to being on the street. So that is the kind of impact that people are really every day facing and thinking about. And they reach out to us at 211. We are 24/7, so we're grateful. We're worried about the people facing the stress, but we're grateful that we can be here for them when they are struggling.
Yeah, no, it's very unfortunate when people are having to make decisions like that. Electricity
Right,
versus, having a roof over their heads. I mean, these are basic human
right.
stuff, but right now people are really being pushed to the limit. Why don't you just take a moment to remind us what kind of services 211 provides? I think it might make sense for people. Obviously, I'm familiar, so sometimes,
Right,
I just go off of
right.
my level of familiarity. But for our viewers, what kind of resources do you guys offer when people call the 211
Good.
number?
Good question. I probably should have started with that. Right. So for people who don't know, 211 is a 24/7 helpline and a hotline. So most of the population of the US has access to a 211. And the way that I think it's like 95% of the people in the US have a 211 in their community. So the way that it works, the analogy I give is it's similar to how a 911 system works. When you dial the number 911, you don't get a national dispatch center. You get routed through technology to your local law enforcement provider. So 211 is the same, and each community handles 211 slightly differently, just like one police department may be a little bit different from a different police department. So some 211s are really just information and assessment and referral and connection to services, and others provide some additional services and programming and hotline. So for our particular 211, we've got that information referral. So people can call us when they've lost a job. They can call us if they're worried about their aging mom and how to cope, or a child that's acting out, or someone who has a mental health or a substance abuse issue concern. So all of those people can call, and our team maintains a repository of all the services in our entire region. So for us, that's more than 1,000 different agencies that we partner with, and we can get that real information for people when they call or text and share it. Additionally, if people are in an extreme crisis, they can call us and we can connect them they can call us, and our staff are trained suicide prevention counselors. So we can actually de-escalate and talk people through. And we get, this is, as you know, this is Suicide Prevention Month. And
Yeah.
so we at our particular center get about 10 suicide related calls every single day on average.
And that's in South Florida alone. I mean, that's
Right.
tough.
Right. That's just in our little geographic area. I was looking at some of the data before this call, and one of the things that came to mind was that you may have seen the CDC just released a study where they were showing since the pandemic, approximately 40% of adult Americans in June said that they felt they were having mental health stresses related to the pandemic, right?
Mm-hmm.
Incredible numbers of people are just, and you know, it sounds like a lot, but at the same time, it makes sense that we're all facing something that none of us have ever faced before.
Sure. Yeah. I think it's in some ways on par for some people with like a traumatic experience. Although a
Right.
lot of us have been able to stay home and work from home and not been directly affected, the emotional and cognitive toll of all this, I'm not sure will be fully understood for honestly many years.
I think that's true.
So for people who are watching this now, they're concerned, perhaps they have a loved one or they themselves are struggling. What would be some signs or symptoms that you would say that people should be looking for that someone may be in a state of crisis and might need to consider reaching out to a 211 or, some other kind of frontline provider for additional help? What should they look for?
Yeah, I want to talk about that for a second, but before I forget, I also want to make sure that I tell people that you can go to our site, 211palmbeach.org, and we have a lot of information on suicide prevention, as well as the National Suicide Prevention Lifeline. And that site is suicidepreventionlifeline.org. And I'll share those with you so you can have them on your website. So those are a couple of places to go. Some of the common signs, warning signs would be, the main thing to look at first is if someone has really had a shift in behavior. So if they are really just not acting like themselves, an easy thing, it may not be an extreme crisis, but an easy thing to say, and we always encourage people to just talk to each other, something as simple as saying, you just don't seem like yourself. Are you, how are you feeling? I remember having a call with somebody a year or so ago, and I hung up feeling like that. I just thought they just did not sound like themselves. And I called back and said, I know this might sound weird, but you just didn't sound like yourself. And I just wanted to make sure that you're feeling okay. And we talked for about half an hour about some stress that they were going through. So that kind of human connection is just really important. Larger warning signs would include things that if people actively say they're not sure that they want to live anymore. Sometimes people might not say, some people may say, I'm thinking about killing myself. Others may say, I wish I wouldn't wake up in the morning. If you hear that kind of thing, that is a warning sign. You need to take that seriously. So what you want to do is you want to talk to them. You want to make sure that they're safe. You want to encourage them and remind them that we have numbers like 211 or the National Lifeline. If you're not in our area, you can call 800-273-TALK. There's also a chat feature, so people can get access to help very quickly right away. So you want to encourage them to do that. Of course, if it were an extreme emergency, always call 911, to get help if it's a life-threatening situation. The other thing that we tell people is that if you know somebody in distress and you're not sure what to do and you've talked to them, you can call us yourself. If they're not responding to help, one of the things that we will do is if you had a friend read and you called us and you said, this friend, I've talked to them, they won't call themselves, I'm not sure what to do, we can actually place a call on your behalf. We can reach out to that friend if you give us that contact information and just say, ideally we would use your name, your friend Reed is worried about you. But if you didn't want to do that, we could say, we got a call from a friend of yours and they're just worried and they wanted us to check on you. This is completely confidential and anonymous. Would you like to talk? And, how are you doing? Mm-hmm. We can do that.
I didn't realize that you offer those sort of wellness checks. That's great.
Yeah.
That's really a powerful service that people can use to just let loved ones know that they're not alone and they are seen and heard, and there is an additional layer of help that honestly a lot of us might be able to benefit from right now.
Yeah, one of the things that's most common for us to hear on a call like that is for people to say that they felt like there was no one else in the world that cared about them. So often us being on the phone with them and listening and empathizing and being able to say, I care about you right now. I'm on the phone with you right now and I care very much. And we do. The people who do this work care so very much.
Mhm.
That is very powerful.
Sharon L'Herrou, as always, great to see you. Thank you for sharing these anecdotes, these resources with us. And I know certainly on behalf of Retreat and many of the people in our community, we're grateful to know that you and your team at 211, in spite of the challenges we're living through, are there on the front lines to provide an additional sort of social safety net of support. And thank you so much for your work. For our viewers, if you want to learn more about 211, we'll share the link to their website. And of course, you can head to retreatbehavioralhealth.com for more information. Sharon, I think we're going to link out to your site for more of your
Great.
helpful resources too. So we'll share that with our viewers there.